with that. All right, there we go. Back to you, Tika.
Hi, everybody. I'm very excited to be here today and glad you could all join. My name is Latika Crew. I am the Health Equity Coordinator here at the Philadelphia Department of Public Health, also in the Division of Chronic Disease and Injury Prevention. I will be working closely with community-based organizations for this grant opportunity, which I'm very excited about. I will also be co-coordinating with one of our partners from Health Federation, Megan, who I will ask to unmute and introduce herself as well.
Hello, everyone. It's very nice to meet you, and thank you for joining us today. My name is Megan Cooper, and I work as the Community and Program Coordinator at the Health Federation, and I will be supporting Latika in engaging with all of you through this grant. So thank you.
And hello, everyone. I'm Morgan Kelly. I'm with the Department of Public Health, working alongside Erica and Tika on this grant. Back to you, Erica.
Great. Thank you. So we'll go on to the next slide and go over the agenda. So for today, we'll be providing some background about our team, the Cardiovascular Health Collaborative opportunity, the grant it's funded through, and then some context as it relates to Philadelphia. And then we'll spend some time kind of outlining an overview of the potential project ideas that CBOs might be interested in considering to participate in through this opportunity. And then we'll open it up for some questions that you may have and then outline some next steps and close out today's session. Go to the next slide. So for some background, the Philadelphia Department of Public Health, otherwise referred to as PDPH, is a much larger city agency that's made up of around 9 programmatic divisions and a few administrative divisions. So within PDPH, our programmatic division is centered around preventing chronic diseases and injury throughout the city. So you can see below in the middle blue section that our division has a number of different teams. The first 3 are our key program areas: nutrition, physical activity, tobacco policy and control, and injury prevention. And then below that, there are many other teams, including data, policy, media, and then our community partnerships and health partnerships teams that overlap in across all the different teams within our division. So our work overlaps there. This opportunity is coming specifically out of the health partnerships team, which again is our team. And as you can see in the bottom green section, we also have some key areas that we focus on within this team. So currently, our largest efforts are in the areas of grant-funded cardiovascular health work, and then our task force that convenes partners from different sectors to connect Philadelphians to resources and support their social and health needs. We're also building out work to address asthma and access to primary care in the city. Slide. So that's context about where this work is situated within the city and within the health department. And now I'm just going to go over a brief background about cardiovascular health and what it's looking like in the city and why we care about it. So cardiovascular disease, often also referred to as heart disease or abbreviated as CVD, is exactly what it sounds like. It encompasses health issues that affect the heart and that can sometimes lead to outcomes such as chest pain or increase in severity to things like a heart attack or stroke, which can be deadly and or negatively impact a person's quality of life. Some medical health related conditions that can contribute to the development of cardiovascular disease are high blood pressure and high cholesterol. But there are also additional non-medical health related factors that can contribute to the development of cardiovascular disease or make it harder to control. So on the right, there is a diagram that you'll see that kind of lays out some of this, and I won't go into all of the details of the diagram, but to pull from it, I will point out that, you can see that it lays out that in addition to these medical health related conditions like high blood pressure or diabetes, that the status of social factors too can determine health. So things like individuals' neighborhood and environment, access to healthcare, or economic stability, among many others, can act as long-term or chronic stressors that could increase the risk of cardiovascular disease or make it harder for those who already have it to manage it and prevent more severe health outcomes like that stroke or heart attack that we mentioned. So, going back then to this left panel, two kind of large areas or broad categories of contributors to cardiovascular disease that we think we could address are these medical related health factors, high blood pressure and high cholesterol, but then also these non-medical health related social needs, which we've been referring to as social needs. Going to the next slide. So a little bit of what cardiovascular health looks like in Philadelphia. Overall in Philly, around 33% of the adult population has high blood pressure and around 31% has high cholesterol. However, from looking at our data, we can see that there are some geographic areas in Philadelphia where rates of both of these conditions are much higher than as it compares to the overall city. So when we pulled our data, some of these geographies where there were the highest rates were located in West Philadelphia, Northwest Philadelphia, and then some regions of Germantown as well. And so our goal then would be to work to address what makes this the factors that make this the case, because ideally we would not want to have higher rates of high blood pressure, high cholesterol in certain areas that are higher than the rest of the city. So if we move on to the next slide. This leads us to the purpose of the Cardiovascular Health Learning Collaborative and why we're here today. So our division received a 5-year grant through the Centers for Disease Control and Prevention, or the CDC, to work specifically in geographies within Philly where we're seeing those highest rates of medical health related risk factors for cardiovascular disease, but also to improve the management and prevention of these conditions and address those social needs, again, that can also impact cardiovascular health. So looking at this map, these are the geographies that we're especially focused in. As you'll see, there are some neighborhoods in the Germantown area, these other neighborhoods too, Strawberry Mansion in North Philly and the Northwest Philadelphia area. And then there's a few neighborhoods in West Philadelphia that we're also focused on as well. And then through this grant, we'll be convening that learning collaborative that's going to work to try to improve outcomes in these geographies. So we can go to the next slide. So as I just mentioned, we have this learning collaborative working together to improve cardiovascular health in the city by preventing and managing those risk factors for poor health outcomes. The collaborative uses innovative strategies to improve healthcare delivery and connect individuals to the services that address their healthcare and social needs such as housing and utilities, food assistance, transportation, or others. Almost all of our current grant partners and a few others are part of this learning collaborative, and so that's what this slide is reflecting. So we work with both healthcare and community partners within the collaborative. For our healthcare partners, we're currently working with Jefferson Einstein. They're located in the Germantown area. We're also working with Penn Family Care through the University of Pennsylvania Health System that's located in West Philadelphia. And we're also working with federally qualified health centers that provide free or low-cost primary care services to individuals in the city too. So currently those health centers are Spectrum Health Services and then Family Practice and Counseling Network, or FPCN. And then we do have some plans to include it or onboard additional health centers in future years as well. We also work with our city's Office of Community Empowerment and Opportunities, Community Health Worker team. We work very closely to plan and convene the Learning Collaborative meetings with the Health Federation of Philadelphia, who also provides support to the health centers in the city, including the ones that are participating in this collaborative. And we're also working with Together for West Philadelphia, which is an organization that's doing a lot of work and collaboration both within the collaborative and throughout the city around the community health workers' role, leveraging it, expanding it, and sustaining it. And then we also just work closely or stay up to date with the Pennsylvania State Department of Public Health. They have a state level version of this grant and convene a learning collaborative as well. And so we also just kind of want to make sure we're aware of what both teams are doing as well. And then, you know, as you see with future partners, the learning collaborative, oh, sorry. Okay. The Learning Collaborative is still expanding. So our goal is to work with community-based organizations that are serving individuals in the neighborhoods that we're focusing efforts in. Go to the next slide. Oh, just pause and see if there's. Okay, just checking to make sure I didn't miss anyone raising a question. So sorry. All right, I'm coming back to this now. So which brings us to our opportunity. So our goal is to then select community-based organizations that serve the neighborhoods of focus, who are also interested in building partnerships with our healthcare partners and wanting to work together to decrease the occurrence of kind of these poor outcomes related to cardiovascular health, to select them to participate in the Learning Collaborative. When we're saying community-based organizations, this could include local nonprofits, voluntary, charitable, or community service or faith-based organizations, and advocacy groups. And we aim to kind of, within the collaborative, aim to improve the cardiovascular health outcomes in neighborhoods by increasing the number of individuals who receive primary care services and have their social needs met. So therefore, for a CBO, engagement in this collaborative would look like working with other Learning Collaborative members to develop innovative partnerships around that. So then we'll also outline some potential types of partnerships that we've brainstormed with the other Learning Collaborative partners in the coming slides. But we do require that a CBO participating in Learning Collaborative engage in at least one partnership opportunity, and then we would also encourage you to build capacity to participate in others. Funding for the projects would be provided with the possibility of being renewed for up to 4 years. So starting in September 2024, could go up to September of 2028. Some other details here. We do have full Learning Collaborative meetings 2 to 4 times per year. So if you're interested in participating in Learning Collaborative, you would expect to have those that frequency of meetings. We also would have regular every 2 weeks, bi-weekly meetings with both our team at the health department and with the Health Federation of Philadelphia. And then there are a few kind of reporting requirements around evaluation. So a CBO participating in the collaborative could expect to report twice a year on things like project successes and challenges. And we'd work closely with you and our evaluation team to figure out what makes sense and what format makes sense to report that into. Go to the next slide. And I'll just also highlight a few additional benefits to participating in the Learning Collaborative that you might want to consider. So because we have a collaborative of different partners coming from different experiences, backgrounds, and areas of focus, they also carry with them lots of different resources and knowledge. And so bringing together all those partners in a Learning Collaborative would allow the opportunity for shared resources around data, tools, and educational materials. We also have a very robust research and evaluation team. So if you have interests or evaluation interests, we would be also able to kind of help support that or help you move those things forward as well. This is also an opportunity to build partnerships that are actionable and thoughtful. As a CBO, you'd also have the opportunity to partner with other CBOs in the Learning Collaborative and also healthcare providers to address the needs of the individuals you're working with. And then, of course, funding is available through this opportunity, which would allow you to enhance your services or supports that you're already offering to community members. So we'll move into the next slide and I'll talk a little bit more about funding. And if we go back, yeah, thanks. So before I go in a little bit with this, before this meeting, since you all are here, you would have had to have registered. And so for those who registered early, we did send out a pre-info session packet that has a lot more detail about the opportunity itself, expands upon some of the ways that funding can be used and cannot be used, and then some timeline information. And then if you did register, like maybe in the last few, like today or more close to today's meeting, we'll make sure to send out that info session after this meeting as well too, so you have that. So I'll highlight some of the key things here, but just wanted to point out that that's also available too. So for funding, we have a funding range right now that would vary based on work plan activities, of course, but somewhere between $15,000 to $35,000 per partner. The funding can vary from year to year. So for this first year, for instance, we do anticipate that we'll have more funding available to account for kind of like startup expenses. Some key things I did want to highlight also, just because these are commonly inquired about or just things that funding cannot be used for. So through this opportunity, funding would not be able to be used for food or purchasing food vouchers, wouldn't be able to use funds for research. And then funding wouldn't also be able to be used for funding community health worker salaries. Generally, funds aren't also able to be used for purchasing furniture or equipment. So if you have any of those proposed spending items, that would need to be clearly identified out in the budget so that we can make sure that whether or not that could be included or approved. Can go on to the next slide. So what now I'm going to go over is just a slide about our proposed partnership activities. From meeting with our current Learning Collaborative partners, we did outline a few potential project ideas that you could explore. Each of the following options in these coming slides would require discussions with both our team and the other Learning Collaborative partners to determine, whether it's feasible or a mutual benefit. So we don't have a clear roadmap for all of these projects, but we are dedicated to working with you if you're interested in exploring these potential partnerships. And then another note, it's just that these options aren't mutually exclusive. So one or more organizations could participate in multiple engagement opportunities. In these next few slides, we've laid out some descriptions, things to consider, and what the goal would be in sustaining the effort long term. So I'll turn it over to Tika and Morgan, who will walk us through these opportunities.
Thanks so much, Erica. So we're going to go ahead and start discussing some of the proposed partnership opportunities we have here for this collaborative. And our first proposed partnership opportunity would be to collaborate with one of our existing Learning Collaborative partners to host a community health worker, or CHW, at a CBO site within one of those 3 specific target regions that we mentioned earlier. So to ensure the sustainability of this partnership, one of our primary long-term goals is to ideally have a CBO independently fund a CHW, like Erica mentioned earlier, at their sites. And the goal here is to have the continued presence at a CHW at a CBO that would be working with the site to assist your members or clientele with things like navigation for health services, resources, or any social services. So some key considerations for organizations that would be interested in pursuing this specific opportunity. One very important consideration, of course, would be staffing capacity. we would need to ensure that the CBO would have the capacity to support and manage a CHW effectively. Another consideration is office space. So the CBO would have to have an adequate space within their org so that the CHW is able to work comfortably and efficiently and see members. So this space would have to be accommodating overall to the CHW's role. And it would have to have things like privacy and functionality. So that would be another important consideration. And we would also need to consider whether the CBO has the ability to promote CHW services within the organization. And as again, Erica mentioned earlier, it is important to note that grant funds cannot be used to support CHW salaries. So this restriction means that CBOs would need to secure alternative funding sources to cover these costs. And lastly, it would be optimal for our CBOs to engage with our current or existing partners who are already a part of our Learning Collaborative, who already have CHW resources. So this would be mutually beneficial for both parties. And this would also help, of course, to integrate the CHW effectively at their respective site. Next slide, please.
So the second opportunity that we've laid out is kind of a social service provider referral. This would be receiving referrals from a healthcare site. So some of you might already have this in place if you offer social needs or social services support. So this would look like building a strong relationship with one of our healthcare partners to ensure that patients that they screen in their healthcare setting can receive support for any social needs that come up during those screenings. Long term, we'd really like this to be a bi-directional process. So we'd like for both sides to kind of be up to date and communicating often about whether the needs have been fulfilled. So we would also really like for this to be upheld through organizational change. I'm sure many of you who provide social needs support know that sometimes you'll have a strong partnership and then one person on one side of an organization will leave. So a long-term goal of this kind of project would be to ensure that through organizational change on either side of the referral, strong communication can be upheld. And then we also ultimately would like to ensure that patient and community member needs are met and that the services are provided. Some key considerations around this would be making sure that you have adequate staffing and resources to accept more referrals. We anticipate that a project like this would ultimately lead to your organization receiving more referrals from our healthcare partners. So making sure you're prepared for that. And then also any IT considerations and other tech considerations that might be needed to make sure that we can have bi-directional communication. Again, when you receive a referral and fulfill the need or kind of update the status back to the healthcare organization. All right, next slide.
So to get into our third partnership opportunity, it would be building a collaborative relationship with our current healthcare partners to improve access to primary care for community members, which we all know is very pivotal in maintaining cardiovascular health. So for our long-term goals and sustainability here, one of our first long-term goals here would be in connecting community members, of course, to primary care. So we would like the CBO to aid in establishing a meaningful connection between community members and primary care services so that individuals are receiving necessary care so that we're improving those cardiovascular health outcomes. And we hope to develop a clear and effective process for referring these individuals to primary care. So the process would include mechanisms for, of course, communicating referral outcomes between your organizations and our partners. And some key considerations here would be data on health insurance. So it would be important to gather and review data on health insurance status of your members, which understanding whether they have insurance or not will help us tailor referrals. And it would also help with, locating or figuring out who accepts their insurance and addressing any potential barriers that they may have to access. Also, we would need to assess whether the clients or your members are currently receiving primary care elsewhere. So this would help us avoid any redundant referrals and ensure that we're connecting individuals to the appropriate primary care services. Next slide, please.
So the fourth project type that we're considering is navigation for social services. So this would look like for either CBOs that already provide social services, or for those who are more of convening community spaces and might not provide direct social service assistance, having a dedicated staff member to help out community members in connecting with other social service providers. So for example, if you provide one type of social service, let's say you're a food bank, making sure that when folks come in to receive food, if they have other needs, maybe they need help connecting to enroll in Medicare, having a dedicated staff member on site to help with that process. A long-term goal around this is to build a strong network of social service guidance that occurs outside of healthcare spaces. And then we would ideally want this to be a very involved process, building up to a staff member kind of helping with every step of the way, not just handing off a list of organizations to call, but really helping folks make those calls if they need help, fill out forms, all of that. So again, in the 5 years, we'd want to build up to that. And then some key considerations here is any current connections you have with other social service providing organizations. That would be really great to strengthen those if you have existing ones. And then availability of staff to do this work. I do want to note that there might be some limitations around covering salaries for these roles. So if this is something you're interested in, we can work through what budgeting would look like there. Next slide, please.
Okay, so in addition to the proposed opportunities that we've already mentioned, we understand that some CBOs may be interested in something maybe a little more short term. So we do have some supplemental activities that would be available to you. And those would include things like health screenings from healthcare providers, having or hosting health education events or assistance with that, or blood pressure related programming, SNBP, and also engaging your community members in healthy activities that promote cardiovascular health. And this could look like a range of different activities ranging from cooking classes to walking groups, support groups, etc. Next slide.
So I'm just going to highlight a couple next steps. I'm going to drop the link to a survey in the chat. If it sounds like this is something of interest to you, or even if it's not, we do have an option to select that you're not interested at this time, but we would ask that you complete the survey. And again, we will be sending out follow-up information, including this survey. I think we have about a 2-week window that we'd like folks to complete the survey within, and then we will be reaching out to those who are interested to schedule a meeting to talk through things. We see these options kind of as a launching point, so we're hoping to work with you and our other partners to make sure that we can make some feasible programming happen. And then you'll work with our team to develop a formal work plan and establish partnerships with healthcare partners kind of after that initial meeting, if we determine that it makes sense to move forward with having you in the learning collaborative. So I'm going to now turn it over to Erica, who's going to answer any questions you all have. I think we're going to try, Tika and I will be alternating between calling out questions in the chat and giving you a chance to raise your hand. So if you can use the raise your hand function or drop your questions in the chat, that would be great. I think I saw a question in the chat from earlier. So Tika, if you wanted to read that out, and I think Erica will let us know if we have an answer. And for any questions that we don't get to, we will be compiling all of these questions and sending out written responses. And there might be some that we can't answer right now, but we will be sure to provide follow-ups too. So thank you.
I think we had a hand earlier from Neva White. I don't know if you're still on this call. If you would like to unmute and ask your question, or if you didn't have it anymore, that's fine. But I know that that was the first hand I saw. Okay. If you're not here, we can actually move on to Lisa Ritz. She asks, is this funding for direct assistance only and not including operations?
Yeah, great. So, Lisa, these funds can be used for operational expenses such as like personnel, travel, supplies that would be necessary towards contributing towards the partnership. But are there other operational expenses that are more specific that you're inquiring about, or does that kind of cover the operations you're thinking of? Okay, great.
It looks like, I'm sorry, I can't remember your name, but whoever we have joining us from Chosen 300 had a question. Go ahead and you can come off mute if you'd like.
Hearing anything from Brian.
Might have lost connection, but we'll come back if he hops back on.
There's something in the chat here too.
We have from Craig. Said there were a number of referral options in connecting people with health and or social services. How and when does the cardiovascular health component come into play with these scenarios? And also, do you start with concerns of cardiovascular concerns, or is it more general?
I think so. That's a good question, Craig. So I think there are lots of flexibility with what this could look like. I'm thinking around the connecting individuals to health or social services through referrals is that, you know, if we can provide individuals with support getting connected to those services that would address those needs, that would also be supported in being able to have less things to have that being a focus of or something that's a barrier to being able to manage any cardiovascular health risks they have. So in the case, for example, of if a patient is being seen in the clinic for hypertension and through some type of screening is identified of having a social need that, and they're also maybe not having very well managed hypertension, being maybe connected to some social needs through a referral process would help both address kind of some factors that could be impacting the ability to manage or basically manage health heart hypertension, hypertension, high blood pressure is what I want to use. Does that help? That clarifies. Okay. And so, yeah, just more broadly, these are flexible options in terms of what it can look like. But to answer the question of why it's connected to cardiovascular health, response.
Just want to reiterate that you guys are welcome to use the hand raising function in addition to the chat if you have any questions.
And if you can't figure out the hand raising, feel free to come off mute. We'll give it another minute or so maybe for questions.
Do you have a number of agencies you're looking to partner with?
Yeah, so we'd ideally like to at least have representation in each of the three geographies that we're focusing in. And so at least we're thinking of at least 3 or more. Yeah.
And it looks like Brian was able to rejoin us. So Brian, I know you had a question.
Recording in progress. So don't laugh, my phone overheated. I'm in South America on the equator.
Nice. Sounds exciting.
So One second here. I think I have a second device here. I'm going to close this one out. I'm good to this one here. It'll be a little lot better. Hold on a second. Sorry about that.
No worries.
Uh, okay. I'm switch phones. So my question is that for the geographical locations, I noticed in the zip codes that my zip code 19104 was not included, but we service pretty much the entire West Philadelphia community. And so I guess is that a concern for one? That's the first question I have for you.
No, so that's a great question. So those geographies, we recognize that the way that those kind of geographies are identified are at a kind of measurement level, like census tract level. So we recognize it doesn't necessarily correspond with like zip code or areas. And so and understand that certain organizations that are serving, if they're serving a zip code, that those neighborhoods would fall into that, or if even just the region, there might be many people in those in that zip code or area that would also be going to an organization as well. So that's not an exclusion, like that doesn't exclude you from being a part of the learning collaborative. It's just more of an interest of if you are finding that there are a lot of people in those maybe neighborhoods that do also come to that you provide services to in through your organization. So it doesn't have to be only those, like it's not that you only have to work with those specific neighborhoods, but that there are people from those neighborhoods that you're servicing. We're looking for organizations that are largely serving those populations.
Okay. All right. So the second question that I have is that I wrote these down and I got befogged because my phone went hot. So let's see here. Okay, yes, the partnerships. You mentioned Together West Philadelphia, and we're actually part of Together West Philadelphia. We're one of the trusted venues. And I know that at one point you said that it was necessary to collaborate, and since we already collaborate with them, and then we also collaborate with Penn Medicine, are those sufficient partnerships to, as far as that part of the qualification of the grant?
So that's also a really great question. And I think I'd like to provide, when our team reconvenes, think a little bit further about this. But what I could say now is, so you're to make sure I understand, you're saying that you have some kind of partnership, collaborative happening already with some of these existing partners, Together for West Philadelphia and Penn. Could that partnership be considered as part of the one of the partnerships in the learning collaborative? Is that the question?
Yes, that's correct.
I think that one would definitely want to hear more a little bit about the partnership to see if the fund, like if there were funding needs to go towards that. But if they are not necessarily the same, like if it's different in terms of with the Penn, are you also working with Penn Family Care or different Penn?
So it's Penn Medicine. We also work with a shop, and then also University of Pennsylvania, as far as like blood pressure screenings and things like that. They come to our evening meals. But our goal in the next couple of months, and we're working with shop on this, is to open a complete daytime program that is going to be Monday through Friday. We don't currently open during the day except for special projects like barber care and things like that. But we want to open for the entire day, Monday through Friday, so that way that people can receive services during the day, as well as our evening meal process that we have as well. But I think one of the greater concerns that I have as far as the questions are concerned, just listening to the things that you're not willing to fund, like staffing, and I'm trying to figure out, okay, what can we get funded? Because I mean, one of the biggest needs is that when we open an additional time, we have to staff that. When we provide counseling or we provide referral services, we have to staff those things. And that's probably one of the largest costs in doing any new projects or strengthening other ones, is that how can we have the appropriate staff for those things?
Yeah, okay, that helps a lot. Well, first I will just clarify that funding can be used for staffing for personnel, but not for specifically for like a community health worker. So if you're anticipating a community health worker to step into that role to provide those services, then we wouldn't be able to use funding for that. But it can be used for other personnel costs or staff costs otherwise. But to just kind of more broadly then to your question, I would say, so the folks we have at the table for Penn might be different than the folks that you're working with. And then you also mentioned you're working with Together for West Philadelphia. I think we would encourage you to share your project ideas with us. And then we could talk more about it, because I think the idea is the goal here would be to work with the partners at the table at the collaborative to kind of create an innovative, like a new partnership. So if you have something that could be built and integrated with some of the other partners in the collaborative, that would, that would be great. Or if it's something, a new idea, then that's also great too. Does that?
Okay. All right, so I don't take up everybody's time, but I guess if you could email me your information, and so that we can have, I guess, a longer conversation. I'll be back on the ground, well, on our grounds next week, and we can have a better conversation about it.
That sounds great. And we have, we'll share information, but also we have, we'll be planning to have intro calls throughout the month of September to kind of go through the ideas. If you want to share out, complete a survey that we'll share out as well to share more details too.
Awesome. Okay. And it's interesting, Risa is actually on the line.
Yes.
She's actually from Together West Philadelphia. And so we've been working with them over the last a couple of years as a trusted venue. And so, we're looking for different ways that we can implement things. But one of the, like I said, our biggest need is that how do we cover our costs on our end to make sure that we can implement these programs and make them more effective.
Yes, that's great. Okay.
I see David has a question.
Go ahead.
Thank you. So just for this, after doing the initial survey, and then we have this introductory meeting, can you just talk a little bit about how much detail you're looking for us at that meeting? Is that a time where we're really expected to be able to say, here's what we think our project's going to look like, here's who we want to partner with, here's what we think it's going to cost? Or is that a little bit more just to sort of like flesh out some possible ideas? So it's like how much preparation are you expecting from us before that meeting?
Yeah, that's a great question. So starting with the survey asks kind of a little bit of that high level, or what are your ideas, kind of to draft those out. It doesn't have to be fully thought out already, or just kind of what you're thinking after this info session, what kind of budget you might be expecting for the project idea that you have. And then our idea is that with the introductory call that we would set up is kind of a combination of both of what you said. So hearing more about your ideas, and then as much detail as you can provide about like what implementing it could look like, what you might need and things like that. And what we would then do is take that to kind of reflect internally and with our other partners, and think if there's any other information that we need to kind of proceed with moving forward. So it's going to be a bit more detailed than what would be in the survey, of course, but then in terms of if you were then after the intro call, some communications, if we then agreed to move forward with proceeding into the learning collaborative, we would then work with you to actually flesh out a work plan and full budget that would then conform an agreement. So those more clear details would kind of come together in the agreement forming process.
And I'll also just chime in that most of this is kind of, we're really encouraging partnership and collaboration. And so we recognize that some of that will have to, you can't come with just one side of partnership and have it be complete. So we recognize that, and we'd want to build with you and bring the right folks into the conversations. Looks like we have another question in the chat.
The Trish Downey, is the CBO supposed to provide funding and hiring for the CHW, or would that come from the LC? Yeah. So Trish, so funding for the CHW first wouldn't be able to come from these funds through this opportunity. However, if the CHW option is something you're interested in exploring, there are others in the Learning Collaborative who have some knowledge or experience are also exploring in that space too, that we could generate conversations with about what are some other options for providing funding for the CHWs. But for this opportunity, like the grants, the funds you would receive wouldn't be able to fund the CHW. So that was something you'd be interested in. We would have to work together with others in the Learning Collaborative to think about what options are available there. All right. And I also see from Craig, is there a timeline for announcing successful grantees? Yeah, so our goal is to have, be able to share decisions by, I believe I'll clarify this, but I believe we were planning to send it.
All right, sorry about that.
No, you're okay.
Sorry, to announce by October with a plan to then, or let, not a formal large announcement, but just kind of notify the organizations that we'd like to move forward, and then kind of work with them over the month of October to be able to create agreements, and then hopefully have them starting onboarding in November. Hopefully that helps. Any other questions? Oh, Catherine?
Yeah, sorry, I was muted. How many organizations do you plan on funding? How much is the total funding that you have for this?
So for each funding for each year could vary, but ranges from $15,000 to $35,000 a year, or per partner, sorry. And in terms of how many partners we hope to fund, we want to at least have representation from each neighborhood cluster, that or geography that we're focusing in. And so that could be anywhere from 3 or more. And so hopefully that helps. So we could onboard more, but we hope to have at least 3.
Thank you.
Mm-hmm.
Sorry, can I just get clarification on your answer? So, so are you saying that you're potentially only going to fund 3 organizations, or quote unquote more, throughout the city of Philadelphia?
3 is the minimum that we'd like to have, and then but we're interested in funding, like, so 3 is the minimum that we'd like to have, but we can fund more than that. So we wouldn't stop at 3.
Okay, so I guess to clarify her question, what was the amount of funding that you have as far as capacity to be able to fund organizations? Do you have, I know there's a limit somewhere, but I think her real question was, what is your capacity?
So our capacities can go up to 35,000. I mentioned earlier that this year we have some extra funding, but we won't know until the end of this grant year what our actual amount will be, and through these conversations with partners that we'll have, with you all that may be interested, that we'll have, and hearing more about your project interests, we'll be able to kind of gauge better what we're hearing from partners. But we don't at the moment, to be able to share an exact number of like our maximum amount for this year, and we don't have that yet, but we do know we'll have a little bit of extra because we'll be starting in this year too with the organizations at the table instead of year one. So 35,000 is what the maximum we're proposing for you to plan a budget around, and then we would be able to talk further about additional funds for the startup costs in introductory meetings and things like that.
Just to clarify, Brian, was the question around the maximum number of organizations we could fund?
Yes.
Oh, okay. I don't know if we have, so I think there's some flexibility in this budget, and we're trying to make sure that we build budget appropriately based on organizations that are interested in the work plans. So I don't know, Erica, if we have a top end of organization, but we would kind of, as we have conversations, we want to make sure that we have appropriate funds to support robust programming with the organizations that are interested. So definitely, yeah, 3 is a minimum, but we are seeking to kind of work with as many as makes sense and that we can fund generously enough to make sure that programming runs smoothly and feels supported. So I don't know that that's a satisfying answer to that, but we can also.
Well, let me give you a more direct clarification of the question, okay? How much money do you have in the bank to be able to spread among organizations?
That's a great question. Is it okay if we get back to you on that in our
Okay, that's fine. If you don't have the
need
answer, that's fine.
I don't have the answer now.
Yeah, and that's fine. I was just trying to get to the answer of the question that the other person asked, and it was a question that I had as well. Because if we're as an organization, I will say this is that it takes a lot of time to invest in applying for grants and developing things just to get a no. And so when we ask those questions, we're asking them because of the fact that we don't want to. If you have 50 organizations applying and you're only going to fund 3, I probably might not take the time to do it. I'd be transparent because I would try to seek out another funding source. But if we have 10 organizations that are applying, and then you're saying you fund 3, there's a better opportunity that I would get the grant. So those are things that we look for as nonprofits because of our limited staffing, our limited time. Is that where do we apply for what is our best possibility? And so we're not just spinning our wheels, investing time and energy in meetings and putting together proposals and reshifting our staff to make things work, and then wind up that is a bust. And so I think her question was a valid one. And it's important that we have, we understand. So, and if you don't have the answer right now, I can respect that. And that's fine. And we can kind of revisit that later. But in the same token, I'm sure we'll have our conversation next week.
That is, yes, I appreciate that, Brian, because it's very I hear you. That makes a lot of sense, and it sounds like this is a very kind of like a key kind of question here, and we'll try to reconvene and see if I can provide more of an answer for you at this time. Regina? Oh.
Hi, yes. Good afternoon, everyone. I definitely collaborate with what Brian was saying. That definitely is something I was considering as well. The other question I had was about the other options that you had in regards to like being a social service referral, and if we did referral for providers. Did you guys have like specific programs or like platforms that we would have to be trained on, or that was something that would be left up to the organization ourselves to be able to learn? I don't know. I just wanted to get a little bit more clarity on that, because I don't know if you guys mentioned that, in the training. So I just wanted to make sure that I understood that. I don't know if there was something like Find Help, because I know we use that. So is that something that you guys were using?
So some of our partners do use Find Help. This is something that would be, all of these things would kind of be explored within the collaborative, because some partners do use platforms like Find Help, other partners may use different things. And so in these partnership, if you move forward with it being in the collaborative, those kinds of conversations would happen to figure out what's the best thing that works for all the parties involved in the partnership. So it doesn't, at the moment, there isn't a specific requirement in terms of what kind of platform you use for referrals or anything. That's just kind of, and then as we have more conversations about what does end up seeming like it will make sense to you, then we'll also be able to kind of figure out how we can support that you or the other organization in trying to get onboarded to that or something like that. Thanks, Brian.
Thank you.
See, there's another question in the chat from Bernadine. How many applications are you anticipating receiving?
To be honest, we don't know how many applications we're going to receive. This is the first time we're doing this, so we're hoping. So I don't have an answer to your question, but yeah, at the moment I don't have a question to an answer to that.
I will say, if it's a helpful indicator, which we can't say that it is, but there are about 30 people on this call, but quite a few of those people, like myself, Erica, Tika, so we have some other colleagues from the Department of Public Health and then some of our partners that are already funded. So based on who's on this call, I would say probably under 30, but we don't quite know.
I have one question. Do you know what the reporting requirements would be if awarded for like the outcomes, and what specific documentation is needed from the grantees?
Yeah, so in terms of just reporting, I can right now mostly what I can share is that in terms of frequency, we would be doing twice a year reporting, and then kind of sharing generally more on like successes and challenges. We actually are in really early stages of this learning collaborative, and so we actually still have to work with our evaluation team, the other learning collaborative partners, and then also a new CBO learning collaborative partners to think about which process kind of measures or things like that we might want to be interested in exploring. But then in terms of for the individual organization, once we have kind of some agreements in place, we would work with you to figure out, like, based on capacity that you have, what you're able to report, which kinds of reporting makes sense. So it's really flexible at this point. But it would just at least be twice a year kind of reporting.
And I do want to note that we are at 2 o'clock, so I just want to remind folks to please complete the survey. We'll be sending out a follow-up email with the slides, the survey link, that information packet that some of you have received, and if you haven't received it, it will come with that. And then any other information. I might be forgetting some things, like the link to this recording. But I don't know if you have any last minute questions, feel free to drop them in the chat or email us.
Are you going to send an email today or next week?
Next week, likely.
Okay.
I don't think we'll be able to get the email out today. Thank you all.
Have a good day.
Thank you.
Thank you,
Enjoy y'all
Liz.
weekend.
You too.
Thank you. Have a great Labor Day weekend, everyone.
Thank you. Did we? Are we still recording?
Oh, I think we are. I'll turn off the recording.